I'm sure you know about the coronavirus, and many of us have a bad memory of it. Are you aware of the latest news about this virus? As you know, this virus is constantly evolving and changing, and it can escape your immune system and deceive you. Today, I'm going to remember some secret about this virus and even bring you some news about it. If you don't watch this video until the end, you may not be safe from the potential dangers of this virus and unfortunately get sick. So stay with me until the end of this video. Hi, I'm Dr. Farzaneh, a molecular medicine specialist. In this video, I'm going to talk about the latest news about the coronavirus and give you and your loved ones the necessary information about your own health. Be sure to send this video link to all your friends, family. Be sure not to miss the end of this video. I have useful information for your health. Be sure to save this video and replay it several times because the information about this virus is always painful. As you know, the coronavirus is an enemy that has changed the world since 2019. The first secret of this virus is that this virus has neither DNA nor cells, but a simple genetic code that, like a hacker controls your body cells. Every time it's transferred from one cell to another, it finds a location and remains like a spy who changes his clothes. Some of the locations it finds are very small, like the Delta strain, and some are much larger, like the Omicron strain. Of course, the new strain KP.3 in 2025 is a combination of two that exists now. The vital point that exists now is that this virus cannot be seen with the naked eyes and can stay alive for months. So be sure not to forget to wash your hands. It's very important for your health. Let's take a quick look at how this virus has turned from a stranger to a familiar enemy. The year is 2019, the year of the war. The first symptoms of the virus were severe respiratory symptoms, fever, dry cough, fatigue, shortness of breath, body ache, and loss of sense of smell and vision. Also, some of the severe symptoms included the shortness of breath. In fact, the virus had a 5% mortality rate and had completely blocked the world. In 2020, the D614G virus was found, which was found in the spike protein. The first symptoms of the virus were in Europe. It was similar to the Wuhan virus, but faster, and the spread of the virus was seen in the upper respiratory tract. Of course, in December 2020, the Alpha virus was seen, which was more severe than the first virus. The risk of death was seen, and cough, sore throat were some of the symptoms. In 2021, the Delta variant was found. The Delta variant was the most deadly version of the virus. The Delta variant was found in India. Its symptoms were 2 times the Alpha and very similar to the first virus. The symptoms were more severe and oxygen of the blood vessels showed less than 80%. In many cases, the symptoms of the cough, sore throat, were very common. And even in some cases, it was from time to time. It was a disease that devastated hospitals. I'm sure you remember this period, and it was very painful and difficult. At that time, the beta strain was reported in South Africa. This virus escaped from the immune system. That is, anyone who had been vaccinated would be infected again. It was seen again, its symptoms were similar to the alpha, but with a higher probability of air and exertion. At that time, the gamma strain was seen in Brazil. The symptoms of the above mentioned were also seen. Headache, muscle pain, and nausea were also found in the symptoms. In 2022, we witnessed the dominance of the Omicron and its subvariants, which had milder but more contagious symptoms, including severe sore throat, runny nose, sneezing similar to a cold, fatigue, and headache. They less frequently cause loss of smell taste. Also, the Omicron subvariant BA.5 emerged, which had symptoms including the return of fever and in some cases night sweats and terrible sore throats. In 2023, new Omicron subvariants appeared. The XBB.1.5 strain had symptoms as sore throat, headache, runny nose, also immune escape even with vaccination, and also gastrointestinal symptoms, diarrhea, loss of taste, and nausea in some cases. The JN.1 subvariant also emerged and caused gastrointestinal symptoms, nausea, vomiting, diarrhea, and severe fatigue, and also muscle pain. In 2024, new variants with immune escape capability emerged, like EG.5, which had symptoms similar to Omicron, runny nose, headache, and also an increase in long COVID cases. Chronic fatigue, brain fog was frequently observed. And the newer JN.1 subvariants that caused symptoms, a combination of respiratory and gastrointestinal. And in already immunocompromised, the individual could be more severe. New studies have shown that JN.1 belongs to the next generation of Omicron and has claimed mutations F456L, which increase immune escape, and also R346T, which reduce the effectiveness of vaccine antibodies and previous infection. In 2025, we are witnessing the presence of KP.2 and KP.3 strains. In fact, a dangerous combination Omicron's speed plus Delta's aggregation, and they can attack new body systems like the brain and heart. As of March 2025, KP.2 and KP.3 have rapidly replaced JN.1 in the United States, India, and South European countries. The clinical symptoms of these new strains are very similar to JN.1, but with some differences. Severe sore throat, and runny nose, dominant symptoms, and extreme fatigue and brain fog are seen more than previous strains. Afghanistan or diarrhea is seen in 20 to 30% of cases and less frequent because loss of smell taste. In terms of disease severity, it appears milder than Delta, but in unvaccinated or immunocompromised individual may lead to hospitalization. At the present time, why are KP.2 and KP.3 concerning? They can easily evade your immune system, and current vaccines, even the updated 2024 vaccines versions, have reduced effectiveness. There is an increased probability of reinfection, and even in vaccinated individuals. They have high transmissibility, and regarding treatment response, Paxlovid is still effective, but some monoclonal antibodies have become ineffective. Now it's time to examine the status of 2025 vaccines. The updated 2025 vaccine targeted KP.2 and XBB.1.5 and likely have relative effectiveness. Important recommendations are that booster dose must absolutely be administered to high-risk groups such as the elderly and chronically ill patients. Definitely using masks in crowded spaces, especially to prevent long COVID. The KP.2 and KP.3 strains in 2025 demonstrate the virus's conscious evolution toward the immune escape, but fortunately symptoms are mostly mild. However, monitoring new mutations and updating vaccines remain crucial. After more than 5 years since the COVID-19 pandemic began, the virus is still among us. But the good news is we no longer have that terror of 2020 and 2021 because the virus has evolved or mutated, but our knowledge has also become stronger. So what's the COVID situation in 2025? Stay with me. The coronavirus is still mutating. The latest dominant variant like KP.2 and KP.3 belong to the Omicron family, which fortunately mostly cause mild cold-like symptoms. But if you have a weak immune system, you need to be careful. Vaccines remain important in 2025. We'll likely see new booster dose updated to fresh variants. If you're elderly or have underlying conditions, be sure to consult your doctor. In the post-COVID world, you need to prevent smartly, not fearfully. Take this new weapon seriously. Use next-gen masks. In subway or hospitals, use N95 masks with smart filters. Regular cloth masks no longer work. Super ventilation is very important. Fully open windows for 5 minutes every 2 hours. Targeted disinfection. Only disinfect high-touch surfaces like doorknob or phones with 70% alcohol. Don't forget this point. Over-disinfection weakens the immune system. You must maintain a strong immune system with proper nutrition. Your body is like a fortress. Deliver this food soldier to eat daily. Vitamin C, observe it daily via consuming the red bell pepper, kiwi, and orange. Various probiotics such as probiotic yogurt can elevate up to 80% of immunity in the gut. Absorb zinc daily via eating pumpkin seeds and beef. Receive vitamin D through eating salmon, egg yolk, mushrooms. Also, don't forget morning sunlight. Core antioxidants like green tea, turmeric, dark chocolate are very important and useful for your immune system. Remember, viruses love these three things. Quit them starting today. Sleep deprivation, less than 6 hours of sleep, 3 times higher ICU admission risk. So be careful. Solution is chamomile tea and complete darkness in room. Chronic stress is very bad for and awful for your immune system. Also, high cortisol weaken your white blood cells. And the solution is 5 minutes of diaphragmatic breathing daily. And also be sure to watch the anxiety videos I have posted on this channel to control your anxiety. This is very, very important solution for you. Okay. Daily moderate exercise increase antibodies by 50%. So brisk walking and don't forget morning yoga. Finally, the golden tip is do these things every morning. Drink 1 glass of warm water plus a lemon for liver detoxification. Be aware about 15 minutes of sunlight can help you for vitamin D production. Check blood oxygen level if you have below 92%, it's warning. A strong immune system is better than any vaccine. Take it seriously. COVID has become a seasonal disease in many countries, but health organizations are still monitoring for dangerous mutations. Fortunately, mortality rates have significantly decreased compared to previous years. Be sure the COVID in 2025 no longer has the terror of past years, but carelessness isn't acceptable either. If you found this video helpful, don't forget to like and comment and subscribe for more information. And if you have any questions, ask them so I can answer. I care about you. Please look after your health.